Okay, great. Thank you. So today, first, we're going to start by talking about using Medicaid opportunities and Medicaid dollars to support nutrition security. I realized that this was an interest for many of you as it was brought up last FABAC call, so we wanted to take some time to discuss what's been going on with that. So to provide a little bit of overview that I already sent on the email, sorry to recap, just so that everyone is on the same page. Medicaid is a federal program that's administered in Colorado by the Colorado Department of Healthcare Policy and Financing. And it's administered through this state department through I'll refer to it as the ACC, but it's the Accountable Care Collaborative, which is essentially a program set up to distribute the federal money that comes down for the public Medicaid, public medical health insurance. So through the ACC, the State Department distributes this federal money to entities called RAIs, which are Regional Accountability Entities. And they're essentially groups that administer the program, give out the money, and handle how the program is distributed to Medicaid members and how doctor providers are instructed to use the Medicaid insurance program. So there's 7 throughout the state, and you can think of them as like a company organization that is essentially in charge of handling how Medicaid is distributed through Colorado. And the way that they administer Medicaid is controlled by a contract that's signed between them and the state agency. So that contract is something that has to be negotiated. And right now we're in the process of negotiating the 3rd contract, or what's called ACC 3.0. So this is just the 3rd contract between the RAIs and the state agency that administers Medicaid that instructs how RAIs have to use Medicaid money, what type of incentives they're allowed to provide, and how they have to mandate certain rules that doctors have to follow. It controls a lot of the ways that different waivers can be used so that Medicaid can be used for things other than just direct doctor's appointments. And for us, that means being able to use Medicaid dollars for food security, helping people get enrolled in SNAP or WIC, and helping people have access to produce prescription boxes and other ways that food can be used as medicine. With the negotiation of this 3rd contract, there is some room for stakeholder engagement and other forms of feedback from the community so that we can try to make this contract incorporate all the things that we want to see in there, that we want RAIs to be held accountable for, that we want doctors who are taking Medicaid to be doing, and making sure that they're working with patients in a way that is equitable and focusing on food as medicine. So that is like the main overview of what's going on right now. And then it's kind of a complex process of how this contract is being written. It won't go into effect until 2025. So it's still a little bit away, but it takes a long time to write this sort of thing. So I've been working on it since about last fall. Nourish is engaged in a strategic group right now that's trying to incorporate some ideas with other groups like Hunger Free Colorado and Blueprint and other groups in this sector. So yeah, I guess that is the gist of what is going on right now. And we're trying to, I guess, get some feedback and any questions you all might have of what could potentially be included in these rules that will then be in the contract for how food can be used as medicine with Medicaid dollars. So if you have any questions about that explanation or any input, questions, or feedback to provide, we can have an open floor conversation about that.
Hi, this is Laquita Walker. I have a question.
Yeah.
So when you said, what contract again will go into effect in 2025?
Yeah, so it's called the Accountable Care Collaborative 3.0.
Okay.
I can drop the link too.
I guess I have a question.
Turner.
Could you tell us a little bit more about like how these community health navigators will have to like document their work in order to be reimbursed by Medicaid? I imagine that like this will become sort of a process, right?
Yeah, I don't know a lot about these specifics. There might be someone else on the call that actually knows more than I do on that. But I think that part of what the Rays have to agree to ensuring that all the doctors that they cover within their region follow is something such as reimbursing actions like that, if that makes sense. But I wonder if anyone else has a better answer to that.
I don't, but I'm wondering, Inka, if you do you have, since CDPHE already has a process in place that essentially sort of certifies, if that's the right word, community health navigators, and do you have any more insight into that, Inka?
I can speak very loosely about it, but essentially what it is, it's just allowing for community health workers that work in health systems to be reimbursed for their as employees of that health system. And so right now, a community health worker working in a health system is paid by general funds within that health system. They're not a reimbursable provider like a physician, NP. But essentially, from my understanding, is that this would allow for community health workers to be part of a billable provider. So if they're providing services to an individual on whatever it is they need, if it's whatever referrals or screening and referring or social services, whatever, that they're part of the healthcare team, the team-based care model. That's my understanding of this work. But if there's interest of this group to learn more about health navigate, we call them health navigators in Colorado, actually, not community health workers. We changed the name about 7 years ago when we had this big push to call them health navigators. We have created credentialing programs at junior colleges where folks can become credentialed as a health navigator. They have to go through a test, an oral test, a written test, and then they essentially get credentialed. And then when they get hired by a health system, they're credentialed as a health navigator, that they know how to use EHR, EMRs, and they essentially become part of the team-based care. But I think the missing component is that they're not reimbursed like other providers are. We are moving back to the term community health workers, because that's what CDC calls them. And so we have in our branch, we have Yvette, and she is our community health navigator. And so she does all of this work. So if there's interest, I could reach out to her if you all wanted a presentation of like what the program is about, what the future work is going to be about. So I don't know if that helps.
So to clarify, that's talking about the one of the state bills in the
Yes.
legislature right now. Okay, yeah.
Yeah.
Yeah. So I'm not sure how that would factor into this Ray negotiation contract with the ACC, but I think that having that in place through a state would be
I don't know where the connection is with the ACC 3.0 and community health workers. It's a question I can ask you, Vet, but I can, I know that there's a bill going through right now to make them a reimbursable provider.
What?
Gotcha. Okay, thank you. That's important to know.
And
Yeah.
Becca, did you see Diane's comment? I'm just wondering, has there been any conversation about including this kind of, this expansive sort of thinking to Diane's chat about what could be included? Has that been part of the conversation?
Yeah. Sorry, I'm reading it now. Cooking classes, shopping classes. Yeah, that's great. I haven't heard about cooking classes or food shopping classes in education, but that's all so important too. We've been mostly talking about, let me pull it up. Using food as
Liam, I'm in a meeting.
using food as medicine to help get more Medicaid members enrolled in SNAP and WIC. So either having that happen on the spot or having money in place to like really facilitate, like if you are enrolled in Medicaid, you are either like helped a lot or highly encouraged to enroll in SNAP and WIC. And then also using Medicaid dollars to support produce incentive programs like Double Up Food Box and WIC CSA and things like that. And the produce prescription boxes that are already in place, but there is so much room too. And I noted your comment in my notes, Diane, about food as medicine through education, outreach, and other community-based advocacy points that need to be addressed and paid for to happen.
And then Becca, if you look at that link that that you chatted in about sort of the timeline for ACC 3.0, it does look like they're planning sort of summer to fall community engagement. Do you know more about that, just for everyone's sake? Like, how are there going to be opportunities for more people to get involved and to kind of weigh in on this and to support this focus on food? Or do you know what that looks like sort of the next 6 months?
Yeah, I'm not 100% sure, to be honest, but I am aware of, it sounds like Blueprint to End Hunger is going to be doing some stakeholder engagement activities and work. I don't know what exactly that will be. I don't think they know yet either. I don't know if anyone's on the call for them, but that should be part of it. And there might be other things as well, whether it's like signing on to letters or having other coalitions created that are more community based. But I think that will definitely be happen once there's more public engagement opportunities available, once that comes to that point in the timeline.
So what's sort of the best way, and thank you, Becca, for doing this overview of something that's, for me, at least pretty complicated. It's a little confusing, but what's the best way for people to like stay involved? Is it something we can just give updates on for now?
I think so. Yeah, I'm not sure if HCPF, which is the state agency that administers Medicaid in Colorado, will be doing any outreach through their newsletters or anything. If so, that might be a good way to stay in touch with this. But other than that, yes, I think FBAT should be providing updates as they come as well.
So there's not really like necessarily mobilization sort of need or activities.
I don't
right?
think yet, unless I'm missing something, but I can definitely look into what that might look like.
Cool, thank you.
Yeah. And if we have any other questions, feel free to bring them up now, write them in the chat, email me. But if not, I'll give it a few seconds, but then we'll move on to Wendy talking about the State Bill 1008.
Thanks, Becca. And I think Becca said this in her email to y'all as well. We recognize this has been like a very low action-oriented food bill action team lately, and that we just haven't had a whole lot of like calls to action right now. And if and when anything is sort of pressing, we absolutely will bring it forward here. It's just we're at a really interesting moment, both at the state and federal level, that at the state level, in terms of legislatively, we're sort of either involved with legislation that they're just doesn't need to be a lot of mobilization around, or we're kind of past that part. And at the federal level, there's a flurry of activity going around introducing marker bills for the farm bill, but they're just now getting introduced. So it's like, in like a week or two or something, we're going to start being like, yes, you know, this is what we really want to talk to our delegation about co-sponsoring some of these marker bills, but we're in this kind of like flurry of writing activity, but not a lot of action yet. So hopefully we'll be moving forward, at least on the federal level, to some more collective action we all can take. And at the state level, legislatively, a lot of bills are sitting in appropriations right now, and then might be moving on to the, you know, either the House or the Senate. Their second committees, and are either perhaps not faring well or perhaps faring well, but it's sort of a low action time for collective action around state legislation as well. So that's all to say, thanks for sticking with us when a lot of it is like updates, but not a lot of actions. But we did want to update you on House Bill 1008, since that's something that we have talked about a lot in the space and is a bill that is our bill. The bill that we have been actively working on with Representative Wiseman. So this bill, generically called On Food Accessibility, this is the bill that builds upon last year's bill, which was House Bill 1380 in 2022, that essentially created the Community Food Access Grant Program that Mickey here is now running in the State Department of Agriculture. So we were involved in that bill last year. Community Food Access Grant Program and the Community Food Access, the consortium, these things are like up and ugly, not running. They're up and about to be running. They're like warming up, off to the races soon. So this work is coming. And then House Bill 1008 this year really directly, especially originally, really built upon a lot of components in that. So just kind of a quick refresh of what House Bill 1008 was, because it has changed. It essentially had three sections to it, three parts to it. One was cash for fruit and vegetable incentives. So essentially cash that could be used just for the cash for, say, like Double Up food bucks, just for healthy food incentives. The second piece was money to continue the Community Food Access Grant Program. And there were also in that bill a lot of some kind of tweaks and improvements to the Community Food Access Grant Program and how it operates, and also just increasing the amount of money it would have at its disposal and running it through the first half of 2031. And then the third part originally was essentially a tax incentive to alleviate the cost burden, the distribution and delivery cost burden of, say, moving, whether like a small local farm to a small independent buyer. So tax incentives for equipment, operations, infrastructure, distribution costs, delivery fees, essentially for our suppliers and our buyers to come together and stock more fresh, perishable products in our independent retail environment across the state. That's sort of what it was. Some information has come to light that shifts what is allowable with the money. If some of you are really geeked out on this, the revenue for this bill was coming from a tax policy change. So it was coming from the revenue from the state business meal deduction. So everyone could still claim their federal meal deduction, but then decoupled from that would be the state business meal deduction. So instead of that going back to taxpayers, the revenue from state business meal deductions would go to the state, to general budget, and then would go to fund all of those pieces. It turns out, and we are in a Tabor refund year, if you take revenue from what was a state tax credit, that money can only go to another state tax credit. It cannot go to cash. It cannot go to programs. So now, so 1008 as it stands now is 100% of the projected revenue will go into this tax incentive program that's still for all the same participants that CDA is already working with, sort of the consortium participants, are farms, ranches, farmers markets, food hubs, small independent Colorado-owned food retailers. So all the same beneficiaries, and then the tax incentive that you can claim against the like equipment, again, infrastructure, distribution, delivery costs for moving fresh perishable foods to our retail and market environments. So that's going to be the bulk of it. And then the bill will also still make sort of some of those tweaks to the Community Food Access Grant Program, even though it's not bringing more money to that program. So it'll still increase the allowable grant size up to $50,000. It will allow applicants to apply year after year and for every location that they own. If they own multiple locations of, say, a retailer, it will increase size a little bit of eligible food retailers, that increase the square footage a little bit, and does extend this program, this tax incentive program for the consortium still through the first half of 2031. So that was kind of a lot. Since we talked about it before, we wanted to make sure we were being somewhat clear about what the bill is now. Yeah, and Becca, did I miss anything?
No, that sounds pretty good. Thank you.
Yeah, so from anyone else too, did I miss anything, or any questions or clarifications about sort of what the bill is or isn't now?
It also did clarify that the Colorado Department of Agriculture will be managing all of the tax credits.
Oh, right, that's right. Yep. So
Administration.
it's still a program for CDA to administer. Yep.
Instead
Well,
of the Department of Revenue, I think is the change.
Yep. And that way it keeps it with the consortium. So the intent is still around how are we increasing, more affordable access to fresh, healthy, perishable products in communities that are often underserved with fresh food access around the state. So the intent is still the same, even though the only mechanism left on the table is the tax incentive. But it keeps it with the consortium at CDA with the same intent.
Wendy, could you talk a little bit more about part one, the cash for fruits and vegetables? Like what was that
Yes.
looking like?
Yes, I can. So, and I think it's okay to be open here that we are disappointed in these shifts, to be honest. And it's not because it's tax law. There's nothing we can do about it. But I guess what's okay to say is that the Healthy Food Incentive Fund and the cash for the Community Food Access grants, the small grant program, are pieces we are very, very committed to as an organization and are very excited about and want to see grow into the future. And we'll be committed to finding ways to get these done in next year's legislative session and beyond. So that being said, I don't act like I'm sugarcoating this. These were changes that we did not anticipate. Is just as the bill passed the House Finance Committee as it was, that this was something that was surfaced with a deeper understanding of Tabor and tax law with this really nuanced tax policy that didn't surface until, very, very recently. So that aside, so your question actually, Amanda, is about, so that originally there's an existing Healthy Food Incentive Fund line item in the general budget. Right now it's only $500,000 a year. But it's cash to buy Colorado grown produce that goes to participants of a federal food assistance program. So, and then it's managed through the State Department of Public Health and Environment. And then that for the first 5 years, and now again for the next term, is managed through us, through Nourish Colorado. So CDPHE contracts with us to manage that cash. We have used that cash to do what's called the Colorado Nutrition Incentive Program. So buy CSA shares for WIC mamas and elders. And then we also use it as match to cash for Double Up food bucks. Moving forward, so the request of this bill was to add $1 million to that line item. It's currently an annual $500,000. The bill would have added an additional $1 million to that line item, which was again cash for produce, and would have been used as match for the federal grant for Double Up food bucks that we are writing right now, because the federal grant for Double Up food bucks requires a dollar for dollar local match. So I will be very honest about the fact that this is significantly limits the federal grant that we can write for Double Up food bucks without having that kind of state match. It is a very significant disappointment, especially at a time when there's an increased need for SNAP benefits with the loss of the SNAP emergency allotment and all of that. So that was like a really long answer because it is near and dear to our work and the things that we believe in.
No, I appreciate that. It actually helps me tie all the pieces together. So thank you.
So,
and I'm sorry. And I'm bummed too.
Me too. Thank you, Amanda. And yeah, we really are committed to really finding state match and state contribution for programs like Double Up Food Bucks that stretch SNAP dollars, increase access to produce, and specifically drive that dollars to Colorado farmers. So we are strongly believe and are strongly committed that the state of Colorado has a role here to match that program, and we'll keep working on it. Yeah, thanks, Laura. Yeah, great questions though. I know we try to keep these to a half an hour and we're right at a half an hour, but I'm happy to, hang out too. So, other questions, comments, clarifications? I'm trying to see if any of our testifiers are on the line. I don't think so. Though Laura testified last year for 1380. So, the next steps in 1008, just FYI, will be going to the Senate Finance Committee. Maybe the first week of April is probably as early as it would be heard in Senate Finance Committee. Obviously, this is still our bill. We still support it, even if it's not in its original highly desired state. And we will bring forward, we'll be working with some farmers markets, and small retailers to testify in support of that. But I think we're pretty good. That's why I wish there were like actions, but it passed, the current version of 1008 passed out of the full House with a lot of support and a lot of support. So I think in the version that is now, again, we don't have any real concerns about what's going to happen. Does that sound good? And my chat is being, oh wait, here we go. Oh, sorry, you're responding to another question. Got it. All right. So thanks, y'all. More action coming. Totally promise more action is coming. Especially on the federal level, as these marker bills for the Farm Bill are just like, they're getting written and introduced left and right. We're going to have a lot of work to do. We're going to want our federal delegation to kind of step up and support. So more coming. And as always, please, if there's something that you all want to bring to this space that like you or your organization is working on, or you want to share and there's actions around, like tell me and Becca, let's get on the agenda. This space is really for everybody to share and get to action around as well. So thank you. And without that, Becca, we got nothing else right on the agenda. We're good.
Yeah, I think we are good to go unless anyone has anything else. Thanks for being here, everyone. Thank you, Elizabeth, for interpreting. And we'll see you in 2 weeks.
Sounds great. Thanks, everybody.
Thank you. Bye. Have a good day.